Hi, What the Health Tech listeners. I'm your host this week, Jacob Mistry, and this is the podcast where we tackle some of the trending topics, ideas, and best practices within health and social care. Today, we're diving into one of the biggest and fastest growing challenges within the sector, and that's cybersecurity. So with that in mind, joining me today is Mark Harris, IT Manager here at Radar Healthcare. Mark brings a wealth of experience managing robust security strategies and supporting partners with their security risks too. Mark, welcome to the podcast.
Howdy.
So, Mark, let's start with your journey first of all. How you ended up at Radar Healthcare, what's your background, and where you've been, as I say, to end up here?
It goes back to probably the age of 11, 12, where I got my first PC, Amstrad EP004 for the techies out there, but I'm going to try and keep this jargon free. After that, I knew that I wanted to be working within IT. All through school, you know, IT this, IT that, careers advice, I want to do IT. Leaving school, I went to do an IT NVQ level 2 in IT through a training provider in Birmingham City Centre. Now, I kind of strayed away from that after that point when I passed that NVQ, and I went into kind of a business administration kind of role. And I was dotted about the city centre just doing kind of admin roles in solicitors and things like that. One of them I went to, it was NHS University Hospital Birmingham, and I was only the receptionist there doing admin tasks, but I got quite into it. And then, you know, the kind of the healthcare, that's when that healthcare journey started actually at that place. I wasn't too involved in all the ingoing and outgoing things are there, but because I was just doing the admin stuff. So I moved away from the IT kind of industry and went into business admin roles around the city centre in Birmingham, doing different things. I was in the post room at solicitors. I was a receptionist at a university healthcare trust, kind of temping and kind of finding my feet, always knowing I wanted to do IT in the end. I finally found my way to working for the council, Birmingham Tech actually. And again, it was an admin-based role, but I always wanted to do IT. I got on well with the IT manager at that place. I was always asking questions, always wanted to be involved. Spent about 2 or 3 years at the Birmingham Tech. And then I actually applied for a role in IT, a company called Cygnus Technology Solutions. And they were a small managed service provider providing IT solutions, help desk, server installs, office setups for everybody in and around the country. That then failed, that business, and then one of the main customers of Cygnus Technology Solutions were a company called Waits Construction, quite a big construction company nationwide, and I believe global now. I got tupied across to Waits Construction, and I had to move down to their head office in Surrey, Leatherhead. I was there for a good 5 years, 6 years, responsible for mainly kind of the networking side of things and, introducing and implementing telephone systems, servers, networks for porter cabins in and around the country, the north of the country. So, for instance, Haribo, which is just down the road from us, Waits were involved in that new building on the M62. So my role there was to provide IT and network facilities for the contractors that were based in that porter cabin. So it was essential to get everything up and running for them and running constantly. Network, phones, the computers. It would usually take months because we had to get kind of comms into the cabins because they were greenfields, so there was nothing there at all. That obviously involved getting MPLS networks and big cables to the compound so they can then run everything off this connection. As I say, five or 6 years working for Waits Construction in that role. I then had to leave Waits through COVID. They cut quite a few job losses. There was quite a few job losses as a result of COVID, and I wanted to get more into the cloud kind of technologies. So it was very on-prem. When I say on-prem, I mean there was a lot of servers and kit and hardware that you had to install and configure. With this new day and age, it's all going cloud-based. So I wanted to concentrate on cloud. did a load of qualifications off the bat of that. And I got the MS500 certificate, which is a security-based Microsoft certificate. And then I went to work for a company called IPEX Technologies. Now, IPEX were a startup company, and I was brought in to look at cyber essentials for businesses, and look at the kind of the cyber aspect of companies, as well as building a customer base for that company and building a team. I was a service delivery manager there, and I was there for about 2.5 years. So we built up quite a good customer base. We had a small team of about 5 or 6. And yeah, we were heavily involved in cyber essentials and getting quite a few of the financial services sector companies compliant with cyber essentials. I don't know whether the listeners know, or what happened was financial services, they had to go and get the cyber essentials certification. They didn't have any choice. So that was kind of gold dust for us, because then we had all of the financial services across the country needing IT support in that area, in cyber security and cyber essentials. So that kind of formed the business model for that business for a long while. I then looked elsewhere, as most people do when they're in a job, and then I found a company called ITEX. So ITEX is a similar kind of company. They're the managed service providers, offering exactly the same kind of services that IPEX did. But the role I went into was an operations manager. So it was overseeing the internal departments, the help desk, the projects team. We had an education branch that went out to schools. That was really good. I got a lot of exposure, and I was involved in a lot of the cyber stuff, including kind of the phishing campaigns that are really good for training. I was involved in cyber response plans. I was involved in multi-factor authentication, all these different technologies and controls that we were able to push out and make businesses secure. I was involved in from the start. And that brings me to where I am now at Radar. So I've only been at Radar for 4 months, come up to 4 months. So far, so good. And that's my journey in a nutshell. I didn't want to go on too much, so I could have given you some more stories, but yeah, that's in a nutshell.
No, that's great. That's really good, and it's clear you've got a vast experience within obviously managing and IT. So, like I say, you've come into the sector fairly recently, a few months now. So, with that in mind, why do you think cyber threats are such a big sort of issue and threat within our sector, from what you've noticed so far?
Well, cyber in general, bad actors is what we say in the industry. Every company is under a threat, really, with cybersecurity. Healthcare in particular, you've got quite highly sensitive data, like patient data and things like that. So it makes it a prime target for bad actors and hackers across the world, because that's the most valuable information. Those assets, they can be sold on the dark web, and they can get more money for that, and more ransom if it's a ransomware attack. Also, one of the things that's been highlighted since I've been working at Radar, quite a few healthcare companies have old systems. So the older the systems, the less chance that they're going to be up to date and patched and secure, and it just leaves a gaping hole in their defenses. You've also got some healthcare providers that have got really limited budgets. They haven't got an IT budget. They're just about surviving on Windows 7 machines, and again, all that increases vulnerabilities and risk. There's a massive rise in ransomware, as you know, which is why we're doing this podcast. And there's phishing campaigns, and they're targeted at patient records and people, with less than adequate defenses. So, I think those are the 3 key points that I would take away from being in the industry at the moment.
Yeah. So these sort of attacks that you mentioned there, what would the impact be? Like the real impact on the organisations, but not just the organisations, I suppose, the actual patients within these organisations, the trusts, the hospitals, the care groups.
So I've done a bit of homework, and I am going to read from a script on this part, because I've got some real world examples just to give you an idea of what happens, the impact, the mitigations, and what the best practice is to avoid those. So there was a Synovis ransomware attack in June 24. So the cause of that attack was vulnerabilities in third-party systems used for pathology services. And the impact on that was that operations got cancelled, blood shortages, and leaked patient data. So I'll go into the mitigating best practices. So best thing to do in that scenario would be to conduct regular security audits to mitigate any of those risks. Cyber Essentials Plus or ISO 27001, they're good benchmarks, good frameworks to use. Limiting vendor access to only necessary systems and data. Segmenting networks, isolating critical services like the pathology I've just mentioned from general IT infrastructure. Backup and recovery planning, incident response playbook. These are all things that would have helped mitigate that attack. There was another one, advanced software group breach in 2022. So the cause of this breach was the lack of multi-factor authentication, or 2FA, which it's commonly known as. There was poor patch management, so there were systems that were out of date, software that was out of date, and as a result, they found loopholes and got into the systems that way. So the impact on that was the NHS 111 disruption. So people couldn't call the NHS 111 for a time. 79,000 plus patient records exposed on the dark web. Again, a couple of mitigating best practices. Obvious one, enable multi-factor authentication, or 2FA. It's essentially giving you a second way of authenticating yourself when you're signing into apps and systems. So enforce that across the board, no exceptions. Monitor the gaps in coverage and user compliance on that one as well. Patch management is a massive one, and vulnerability scanning. So that means the endpoint devices need to be fully up to spec and patched within 14 days is the recommended time frame for patching security critical and important updates is from National Cyber Security Centre and Cyber Essentials. Scanning systems monthly after any major updates and changes. Data processor accountability, and just adopting a good security culture and governance that would have mitigated that risk there. There's a load of other real world examples. Oxford Health NHS Trust ransomware attack on third party mental health record system. Clinicians reverted to paper notes, which delayed treatments. There are other ones that have high financial loss as well, not just impact on the real world things. So yeah, those are a few real world examples.
Yeah, that's really interesting, and it's quite sobering, really, when you think about these will impact real people in these hospitals and in the care groups and in the organisations. It is having a real effect. So it's not just sort of financial or reputational. It's obviously taking away time and people from the care that people need. So you've touched quite a lot on there on how to mitigate these sort of attacks. Is there anything else that maybe wasn't part of them three there? Any other sort of strategies or key ways that organisations can protect themselves? You've touched on 2FA, the passwords and that sort of thing. What else could they do?
Yeah, so having good policies in place is key. So I would say policies and user training. Often it's the end user that kind of opens the gate to hacks. There'll be some unsuspected employee that downloads something off an email, doesn't realise what it is, installs it onto the system, and before you know it, you've got a fully infected encrypted system that's a ransomware attack, and then you're kind of screwed from that point. But a few of the other ones, regular patching. I know I mentioned that, but that's another key one: patching of systems and endpoint protection. So having a good antivirus that not only looks for viruses that have got signatures, known signatures, but antivirus has got kind of the new age of protecting devices. It uses kind of like heartbeats, and it looks at suspicious actions. It's kind of like AI in a way. It looks at anomalies. So it's not just the signature kind of base attacks that it's finding. Incident response plan is another good one. So what to do if there is an attack. who's responsible for for the actions. Usually, there's a team of people that kind of implement a playbook. So what happens if, and there'll be different scenarios of what happens if this happens. So it's good to have that in place for sure. And again, like I said before, a big one is investing in staff training, because the more staff are trained, the less likely they are to go through those phishing channels and whatnot. Certifications is a good one. So if you can go for any of the the Cyber Essentials, Cyber Essentials is a baseline kind of certification, which shows that you're in line with that that's methodology. And ISO is kind of like the advanced one, where you go real nitty gritty and get into the real tasty bits, like the policies, processes, and procedures, and making sure there's accountability and there's risks for everything.
Yeah. So there's quite a lot out there, and obviously, like I say, I think healthcare organisations sometimes might be a little bit behind with how digital their systems are, or how secured they are, I suppose. So internally, Radar Healthcare, all the things you've touched on, how do we keep our own team sort of secure and safe from these sort of cyber attacks? Just to give a little bit more context on what we do.
All of the above, really. It's all of the above. I mean, I've only been at Radar for 4 months, and I'm currently going through and doing a bit of a discovery piece, and finding out all the different policies, processes, and procedures. But yeah, it's covering regular training sessions, phishing campaigns, internal audits, access reviews, asset management, real-time monitoring from within the Microsoft platform, which is what we use. We're Microsoft driven. Threat detection, patterns, detecting risky users. All of these are monitored and acted upon. So if there's, for instance, an account that's been signed in Spain, we'll be flagged of that. We'll look into that and respond to it accordingly based on our playbook. Quite often it's just a VPN or something like that. But those kind of things are constantly monitored. From what I can tell, there's a culture built around accountability and vigilance. So we've got Slack channels that we use that are secured, and there's constant people putting things on those channels to do with security events and asking questions about security. So the culture's built around security in Radar, which is really good. We've also got our own internal penetration testing resource, which always helps. A load of other things that I can mention, but yeah, those are the main ones.
Yeah. Obviously, I know being here, I think your first sort of month and a bit, you're doing a lot of training, and obviously when we're talking about these threats, obviously that's really good. We do put a focus on that, and hopefully there's a lot of stuff there that other organisations listening can pick up. And one thing you touched on there, which is new to me, so you can maybe go into a bit more detail for those listening and myself. We hold the certifications like the ISO 27001, the Cyber Essentials Plus. So I suppose, what do these mean for my sake and the listeners maybe, and why do they matter? Why do we have them? Why should other organisations have them?
It's proof that you've gone through those rigorous audits and checks, and that you've got the right policies, processes, and procedures and controls in place to make sure that you are best prepared to handle any kind of attacks. ISO 27001 proves that we've got an end-to-end information security framework in place. Cyber Essentials Plus, like I said, is kind of like a basic entry level to make sure that you've got MFA, you've got a good password policy, you're mitigating all the basic kind of attack vectors that hackers could use and utilize and exploit. Certification reassurance as well, so dealing with customers and partners, they know that we're handling practices properly. And it also reflects commitment to quality, safety, and aligning with any regulatory bodies. So the GDPR, HIPAA, all of those kind of standards that we have to adhere to. That all contributes and adds to that.
So we've touched on sort of ourselves and what we do and what other organisations should do to protect themselves as well. I suppose one thing we've not touched on, which is important for us and important for the organisations listening, is when you're working with external companies and external organisations, how do you choose them and how do you stay safe with the people you're working with, and maybe sharing information? What are the best practices to staying secure when working with partners?
Like I just mentioned, it's making sure that they're following those same kind of protocols and frameworks. So the ISO, the Cyber Essentials, they're key in choosing any kind of partner relationship, and many of them won't have those. But it's making sure that we are in line with our standards. So the questions that we would ask that we get audited on, we would then reach out to those partners and clients and customers to make sure that they're in line and compliant with all of our own compliance.
Yeah, so it's just being vigilant, I suppose, and it's making sure you do your research, you look into things, you ask the questions, and there is such a risk that you can never do, I suppose, too much securing with cybersecurity. So I think you mentioned it a little bit earlier, but just in a little bit more detail, I suppose. What advice can you give to smaller teams and smaller organisations? Obviously, if you work within a big group or a big organisation, you might have more resource, I suppose, to put into cybersecurity. You might have more people. So for the smaller teams who are maybe just starting to look into this, or maybe take it a bit more serious, or listen to this podcast and maybe wanting to look into it a bit more, what advice do you give to the smaller organisations, the smaller homes, the smaller teams?
It's quite difficult if you've got nobody who kind of represents IT in the business. I guess start with the basics. I mean, passwords. That's one of the best things that you can get right is making sure that you've got a really good, strong password for accounts, and that they're not using the same passwords across all systems. There's different variations and methods you can use to get a kind of random password. We use the 3 random words method, which works quite well because it's memorable, but it's completely irrelevant to anybody else kind of doing any social engineering attacks. So it could be your pet, your partner, and your car, for instance, with a number of capital letters and numbers replacing some of those letters. So that's one of the basic things I would start with. MFA is another big one. So multi-factor authentication, 2-factor authentication. If it's offered on any of the systems, then enable it straight away without any hesitation. Sometimes it does take a bit of work and planning and preparation because, depending on the size of the business, it will affect multiple people. So if it's a smaller business, it's not going to be that much of an impact, and you can get that enabled quite quickly. And that's a good barrier and a good method to protect your accounts when you're online, for sure. You can always reach out on different resources as well. So Cyber Essentials, National Cyber Security Centre have got a really good website, a lot of information there. There's even things like phishing simulation that you can go on. There's some training videos. It's a really good website to go on. So definitely recommend going on that to look at things that you can do to mitigate any risks for cyber attacks. Yeah. And also another big one is making sure that you adopt a culture of awareness. So if your staff do get an email that doesn't look right, or it looks suspicious clearly, or even if it doesn't look suspicious and it's just come out of nowhere, just be vigilant and always stop and think rather than just clicking. Everyone's done that in the past and gone, oh, I'll just click that. Oh, I'm intrigued. What's that mean? Click on that, and then that's it. It's game over. So just stop and think, and make sure that it's from trusted sources.
Yeah, I remember a few years ago, sort of in a previous job, where I got an email and it was sort of, you click on it, and it said, "Whoops, you've been phished," and it's like the IT manager had obviously sent that, and I think from then, obviously doing a lot more training, I always hover over the links and do all the sort of basic stuff because you don't want to be the one that gets caught out, and obviously if it was a real one, it's a lot more serious. So. Yeah, that's there's different things for different size organisations which you've covered. So hopefully anyone listening will be able to take some really good points there. So I suppose we've covered what you can do, what the risks are, what the impact is. What does the future hold then for cybersecurity? What are the trends or changes, or maybe the negative things coming up within our sector, within anything really? What are the trends and what's the future of cybersecurity?
So the biggest thing, and I'm sure everybody would agree, is artificial intelligence.
Yeah.
So this is going to be a massive shift with things. So it not just for trying to defend against attacks, but also the bad actors and the attackers using AI. So I don't know whether you've used Copilot or ChatGPT, but you can ask it anything and it will give you the answers. So that's going to be the biggest shift, and I think that's what the future is going to be for healthcare providers as well. Introducing AI into systems to improve productivity, streamline processes. It's the future. It's definitely the future. You've seen on all socials that what it can do with images and things like that, and videos, which is quite funny sometimes, seeing some of the videos on Facebook and whatnot. But I think that AI is the biggest thing that I would think the future of cybersecurity looks like in healthcare.
Yeah, I think that it's both ways really. I think AI is going to help secure systems, and it'll be able to read things and whatnot, but on the other side it's probably going to be used by attackers as well. So it's definitely one for us to keep an eye on, and hopefully we can keep people updated on whatever trends we see on that. So we got through the questions there on cybersecurity, Mark, and we do like to, at the end of the episode, sort of ask our guests for a moment, or what the HealthTech moment. It can be a standout experience in health and social care. You've been in IT and the sort of industry a lot longer than you have in the specific sector of health and social care. So is there any moment that has impacted you in some way? It could be the weird and wonderful, it could be the really emotional, it could be positive, negative. What's a moment you can leave our listeners with?
I won't say the company I worked for, but there was an instance where it was a mistake that I made, actually. I rectified it in the end, but we had a very large US customer with thousands of Microsoft licenses that were due to be renewed. And there's two different kind of terms that you can choose. So there'll be an annual term, there'll be a 3-year term, and there'll be a monthly term. On this particular occasion, I renewed it as a 3-year term, and they had to pay the full amount in full from Microsoft. And it took a good doing to get Microsoft to agree that it was a mistake.
Yeah.
So that could have been very costly. It's not a kind of a cyber essentials or cyber related moment, but it's just one that sticks out in my mind, because that could have ended up very, very differently.
Yeah, I suppose to link it in, I suppose it's every incident is a learning in it, or it can be a learning. I suppose accidents do happen. It's just got.
Well, this is it. I mean, it's all the main thing is, I mean, like ISO 27001, it's got to be risk based. So what we should have done in that sense, because of the size of the customer, is done a risk assessment. Okay, what are the risks if this happens, and how are we going to mitigate those risks? That's what should have happened. Looping it back into the the cyber world.
Yeah.
There should have been a risk assessment, and it should have gone in the risk register, and it should have been properly planned, and it wasn't. So that's the result of it, of not planning properly and having it in the risk register.
Yeah, that's bang on. So well, that's it for the questions. Thanks for joining us, Mark. It's been really insightful, helpful. I think what's really good is you've talked a lot about sort of the different things they can do, and all the different methods of security, and what smallest teams can do, what bigger teams can do. So hopefully everyone listening can sort of take something away from today. No matter what your organisation is, you can take something away. So thanks again to Mark, and join us next time on What the HealthTech. Don't forget to like, rate, subscribe, and if you do have any questions for our guests or any ideas, please do email us at whatthehealthtech@radarhealthcare.com. Cheers.